has passed the childbearing age still need to take folic acid, iron, and the rest. This actually helps with my hair growth, my nails. It actually helps my skin. But trust me, your skin tells what your body looks like inside. Welcome guys to Nelly's White Lions channel, wife, mom to the cuties, a career girl and entrepreneur. My name is Nelly, aka Nelly White Lion, because I am married to the White Lion himself. Hi lovely, this is Nelly, aka Nelly White Lion. Welcome to my channel. Today we're going to be talking about the importance of prenatals and the type of vitamins you should be having in your prenatals, the important ones, the right amount, and what I am currently taking for my pregnancy, the prenatals I'm taking for my pregnancy. If this is your first time seeing my face, I'm going to put a disclaimer. I am not a medical doctor, and I only did food and nutrition in nursing school. Yeah, I'm a registered nurse, and I think what I'm talking about today is something I know about, you know. And I also have my bachelor in public health, community health, so in a way too, I can also educate. But well, if this is your first time seeing my face, please do not forget to hit the notification bell. Is that what they call it? Please do not forget to subscribe. Hit the notification bell so whenever I upload a new video, you won't miss any of my upload, because you don't know where I'm going to pass that information that will be beneficial to you, your friend, your sister, your aunt, even your worst enemy. Yes, we got to be our sister's keepers too. This is the vitamin I'm taking. It's by Nature Made. This is not a sponsor video. I don't have any affiliate with this company, but their prenatals, I've used it for all my kids, and it contains the required vitamin I'm supposed to be having in the right amount, so that's why I'm using it. And before I got pregnant, I also was taking it as well. We all know when you're taking iron and prenatals, you're gonna have like constipation, but you want to drink enough water to, you know, curb that off. I don't want this video to be long today, but if it means it to get long and I pass out the information, who am I to say stop the video? But anyway, this is Nature Made. To my viewers here in America, you guys can get this at Walmart, Target, Amazon, anywhere. My viewers, international, Canada, European countries, United Kingdom, you can also check in your various stores, your drug stores. You can see Nature Made. If it's good for you, you use it. For me, it's good for me, and that's why I'm using it. The reason why I'm using this is because it has it's a prenatal multi plus DHA, and that's, let me say, almost like fatty acid that is good for formation. Like, you just need fatty acid in your system, you know. And this does not have any artificial flavor. You just take one capsule. This is it, how the capsule is. You just take one of this capsule a day. Everything I need. I don't need to take other stuff. I just take one capsule of that. And it also contains the required vitamins that I need for my baby to grow well. Like we all know, folic acid is important to a pregnant woman, and any woman of child reproductive age. Folic acid is good for you. It's supposed, because you don't know when you're going to get pregnant. If you might get pregnant, you know, pregnancy happens sometimes without you knowing. And at the same time, when you're planning to get pregnant, you want to be taking folic acid at least 3 to 6 months. 3 months at the latest before you take in, because you want it to be in circulation in your bloodstream so that the baby have something to nourish her. Lack of folic acid, we all know, cause neural birth defects. What that means is, you know, there's some kids, when you check their back, they have like a little opening at the back. I'll insert a clip of neural spinal bifida, so you see what deficiency of folic acid can cause. There are two types of folic acid, but I'm not here to go about that, talking about two different types of folic acid. We have folate and we have folic acid. Folate, some people will say, oh, my baby was okay, nothing happened to my baby, I never took folic acid, I got pregnant, this and that and that. The truth is, folic acid is a synthetic form of folate. Why folate? We get folate in our food we eat. That vegetable you eat, in Nigeria they call it ugu or pumpkin leaf. We have folate naturally in it. Asparagus that they eat in Western world has folate in it. Other food you eat like beans, the black-eyed pea beans, you have folate in it. So people might be saying, oh, they never took folic acid and their baby were fine. That's because you got the natural form of folic acid in your food. And this is why they advise pregnant women to eat, or women of reproductive age to eat varieties of food, because there is natural folate in their food. And when you don't, if the two are the same, yes, they are the same, because one is easily absorbed in the body while the other is not. But at the same time, it's still good for you to take it. In my own case, I have folate here. I don't have folic acid in this one. It's folate, the natural form. And I 800 microgram of folate in this recommended dose for a pregnant woman. Now, somebody that is not pregnant, you need to take between 400 microgram to 600 microgram. But when you're pregnant, it's advisable you take 800 microgram at least. Now, we all know the importance of taking folic acid in pregnancy, and even when you're not pregnant. Because even after you give birth, you still need that folate in your body to breastfeed your baby. You understand? And even though you're not pregnant too, or you're not lactating, you're not breastfeeding, you still also need it in your system. Okay? So the important vitamins you want to look for, vitamins and nutrients you want to look for, is folic acid or folate. You want to make sure you have vitamin B6. You want to make sure you have vitamin B12. You want to make sure you have iron. You know what iron is. A pregnant woman needs twice as the recommended, because during childbearing we lose a lot of blood. So you want to make sure you have iron. You want to make sure you have iodine. You want to make sure you have zinc, magnesium, calcium, vitamin A, and vitamin D. Now, why do I say vitamin D? Because vitamin D and calcium goes together. They go together in hand. Now to my, is it chemistry or physiology, whatever. We all know when calcium is low, vitamin D is low, because is it vitamin D or calcium open the door? Vitamin D open the door for calcium to go into the channel. So vitamin D and calcium go hand in hand. So if you're taking calcium, you want to be taking vitamin D. Now, when you're taking this medication, because you have iron in it, your prenatal, you're supposed to take your prenatal with vitamin C. I don't think they even list vitamin C here. Oh, they will have ascorbic acid here. But at the same time, if you want to take your prenatal, I will advise you to take your prenatal with an orange juice like vitamin C, because it helps this medication absorb well into your system. Now, this is why I'm taking this, and I will tell you what these vitamins and minerals that I listed, what they do. Another thing I'm taking now is this. It's called Juice Floss. Like I said, I don't have any affiliation with these people, or this is not a sponsored video, but this thing is called Juice Floss. I got introduced to this vitamin by my girlfriend. Her name is Mary. I took interest in it was because it helps with PCOS. I have PCOS, and people with PCOS, you know, you have to eat a balanced diet. This is Juice Floss. Now, this brand now is the vegetable blend. What this means is that all the vegetable I need is blended into a capsule here. That's almost should I say it has almost, is it 12 or 13 vegetable here. It has broccoli, parsley, tomatoes, carrots, garlic, beets, spinach, cabbage, lemon peel, rice bran, and kale. So you take 2 capsules every day. But because I'm taking the other ones, I'm just taking 1 capsule plus my prenatal. So all the vegetable I need, it's here. And as you know, we don't get all our vegetable in our food because you cannot eat all this food every day. So this vegetable blend plus gives me the vegetable I need for my growing baby and for my body. And this one is the juice plus for berry blend. So it has all the berries. It has raspberry, bayberry, blueberry, cranberry, pomegranate, black currant, blackberry, elderberry, cocoa. It has everything I need. The juice plus, it has the fruit blend plus, it has apple, peach, cranberry, orange, mango, lemon, cherry, pineapple, plum, date, and bread. So this is what I take. Basically, you can see from my voice, I keep telling you that my voice is going. It's because of my PCOS, you know. But that's no excuse. And I also take the probiotic. Probiotic helps you with your digestive system, your guts, meaning your digestive tract. A lot of kids born in the United States are exposed to antibiotics. This is because women, before you give birth, they always want to do your test called, is it a strep B, where from the, TMI, from the vagina, they take like a swab to the anus. And if you, 25% of women test positive for that. Now, that is not a bad bacteria, but for the newborn baby that has not been exposed to it, it's bad. So that's why they give a lot of antibiotics to pregnant women before they have the baby, to protect the baby. Now, when they give you that, as antibiotics is a respecter of no bacteria. It doesn't know what is the good bacteria or what is the bad bacteria. When you take antibiotics tend to flush out all the bacteria. Like I said, it's a respecter of no bacteria, good or bad. It flushes it out. Now, when you're taking probiotics, it helps you regain that good bacteria. And at the same time, even though you don't have that test, is it gram code? I don't know what they call that. I will look for it up and insert it, the name of the test. In a way, sometimes your baby might still be exposed to antibiotics. So if you're taking probiotic, you're passing it, to the baby. The baby guts, digestive tract system is already enriched with good bacteria. Now, this one has 30 billion live cells formulated with 10 probiotic strain. The same bacteria here you found it in what's it called? Yogurt, not just any yogurt, not this sugary yogurt. Those yogurt, they call it Greek yogurt. You look for the live activated bacteria. That bacteria is good for your digestive tract system. And this is the reason why it's advisable to take probiotics during pregnancy. People that cannot find probiotic, eat good yogurt. A very good yogurt, Greek, I believe, has the strain to help you. So, a lot of women don't know how to even choose what prenatals they want to take. The first thing you want to do if you want to choose a prenatal, you go to your doctor. Your doctor will tell you what to take depending on your own body deficiency. Like here in the United States, they give a lot of vitamin D to us here because, not us in the United States, in Minnesota, because we don't get a lot of sunlight. People in the United States can testify to that Minnesota is one of the coldest places, so we don't get a lot of sunlight here. So it's actually recommended we take extra dose of vitamin D. Now, when you're taking vitamin D, you also want to take calcium because, like I said, they go together. Vitamin D opens the channel for calcium to go in. If you're low in vitamin D, you'll be low in calcium. It works hand in hand. Another thing I want to advise you is when you're taking your prenatals, you want to take it with orange juice, anything vitamin C. Vitamin C is also inclusive here. The reason is that iron gets better absorbed by the body with vitamin C. So you might want to get the vitamin C, whatever. That's vitamin C. And trust me, you can never have an overdose of vitamin C, because vitamin C is a water-soluble vitamin, meaning that when you take it, when you pee, you lose vitamin C. Unlike vitamin D, that vitamin D and vitamin A that store in our body, so you can actually get overdose of that, which is not good. But vitamin C, when you're taking your prenatals, it's advisable you take it with orange juice, apple juice, anything that is rich in vitamin C, so that it can help it absorb very well because of the iron in it. So vitamin C is the girlfriend to iron. So you want to do that equation. Now, if you don't want to go meet your doctor, you feel you don't have any health deficiency, you don't have any health issues, and you don't have any mineral or vitamin deficiency, but you want to take something for pregnancy, you can start with your sister, your friend that has taken it before, because when you go to the store, you're actually confused on what brand you want to buy. Yes, you get confused. Even me, I get confused. Thank God I was able to narrow myself to this. Like I said, I am not affiliated to any of this. This is not a sponsored video. This is just something I'm just sharing with you guys. So this particular brand has worked for me. It can also work for you. Another thing people want to check again is the size. This is the size of what I take. My hands are clean. I take this daily, inclusive of this other one. Some people might say it's too big or it's too many. So you decide. Some people also want to take the gummy bear. You can also decide if you want the gummy bear. Me personally, I don't like the gummy bear. And I took this one even during my morning sickness. The smell is not that bad for me. Prenatals is important. It's not just for only pregnant women. Even though you're not pregnant, somebody that has passed the childbearing age still needs to take folic acid, iron, and the rest. It's advisable you take once a day, women, because it actually helps with menopause and the rest. Now, you don't have to buy Juice Plus. You can still check the market and see other vitamins that are good for the body. Like I said, we cannot eat all our fruits, vegetables, and berries that the body needs. This actually helps PCOS patients. I have PCOS. This actually helps with my hair growth, my nails. It actually helps my skin. Yes, I make lotions, oil, and the rest. But trust me, your skin tells what your body looks like inside. People keep telling me, you're pregnant, your complexion did not change, this and that. I'm going to share with you guys what I use for pregnancy, like what my routine did not change. I still use the same thing. But I believe this did a lot to my skin. Now, I'm not saying go buy Juice Plus. I think I bought, I can't remember. Yeah, but I know after pregnancy, I'm still going to continue it because of my PCOS, So look for a good vitamin with vegetables, fruits that you need, because we cannot eat them. I kind of envy my counterparts in Nigeria, like people in Nigeria, because I feel they eat a lot of organic fruits and whatever. But you cannot eat your cake and have it. I cannot stay in America and say, I want to go and be eating those food they bring right from the farm, Here you buy organic foods, they kind of expensive. I try my best to buy the ones I can buy, But anyway, I kind of like this. Thank you, Mary. She was the one that introduced me to this. And when I read a lot, I saw that my PCOS sisters are also using it and they have good stories. And I think I use this in my TTC journey too. I'm going to talk about that too. Pregnant with PCOS. I'm going to talk that. So watch out for that. If you like what I just did, my explanation, do not forget to give me a thumbs up, subscribe to my channel, on your notification bell, so whenever I upload a video, you'll be notified, because you don't know when I can give out an information that will be useful to your sister, your friend, aunt, even your worst enemy. I keep saying this. Yeah? Put your notification bell and watch my video. And to my old subscribers, Thank you so much. I so much appreciate your love, your support. Without you, I won't be here. You know, you guys, when you watch my video, it spur me to make more videos. But anyway, if you like one of these and you want me to be giving out such informations like this, let me know behind. Tell me how you were able to choose your prenatals. The stuff I mentioned, do you have them there? How many do you take? Do you have to take vitamin D, calcium, potassium separately, folic acid separately, all the goodies separately, or do you have to take one capsule just like me? So just comment below. Well, I'll leave you guys here. What do I have to say again? I love you guys. Bye bye. I'll see you in my next video. Mwah.